Do implants need to be replaced every 10 years? That's a really common question, and probably not a bad idea to be thinking about replacing it about 10 years, but if it ain't broke, it doesn't have to be replaced. So implants are an artificial device. We do expect we'll need to replace them at some point. We just don't know when that some point will be. They can wear out, they may be in the wrong position, or our breast may change. We could also have our body respond to the implant with what we call capsular contracture. So in a lot of ways, having this artificial device is guaranteed to have some kind of issue at some point. Thankfully, we work to control and minimize those issues. And as long as the breast is pretty and there's no problems, and we can identify that there's not a rupture of the implant, we're not required to replace it just because 10 years have passed. Can you still get mammograms with an implant in place? Absolutely. In fact, you want to get the same breast imaging you would otherwise get with an implant in place as if you didn't have an implant. We screen patients that we're going to do breast surgery on over 30 years of age or younger if they've had a family history of breast cancer. And afterwards, you still want to get your mammograms. Mammograms are done differently, where the breast is compressed to push the implant back, and we take extra views in a diagnostic mammogram, but they're still definitely done, and we get a good view over all of the breast. Additionally, for a silicone implant, we want to do imaging to identify if the implant's worn out. The minimum I would recommend is every 5 years to do either high-resolution ultrasound now or an MRI. So mammogram itself may identify features of a ruptured implant, but isn't sufficient to identify that we may have a ruptured implant. From a practical standpoint though, really self-examination or just noticing any change. That's always going to be key with an implant in place. If the breast swells, there's any changes, discomfort, you're going to want to note that, get in touch with your surgeon, let us know. So paying attention and continuing to perform self-exam, that's really the bottom line key that's always in place for your breasts, whether or not you have an implant, but especially relevant for when you have an implant in place. So pregnancy and breast implants. The breasts definitely change during pregnancy. So if you know you're going to plan a pregnancy in the near future and you don't have an implant, I would recommend go ahead and wait, have the pregnancy first, then do the breast implant. Otherwise though, the most common reason we see women seeking implants after pregnancy is they've got deflation, particularly the upper part of the breast. It's almost as if the breast is sunk to the bottom and it's deflated like the baby sucked the life out of the breast. So an implant has a special ability to maintain fullness of the upper part of the breast. Generally after pregnancy, that maintains itself, but there can be changes just from the breast enlarging. That happens with pregnancy when you don't have an implant very often. Most of the time, the breast still looks a lot better with an implant in place, and usually there's not a dramatic amount of change for most women with an implant after pregnancy. Breastfeeding and implants, it's a really good question because we would want you to breastfeed if you're otherwise able to and are willing to go through the work of breastfeeding. It's a wonderful thing to do. So I place implants generally under the muscle and most commonly from an incision below, dissecting underneath the breast tissue. There are times with breast lift that incisions need to be made into the breast tissue. In both of those cases, the overwhelming likelihood is that you would still be able to breastfeed afterwards, especially if you otherwise were able to breastfeed. Now, not every woman is always able to breastfeed, and sometimes for some women it takes extra work working with a lactation specialist to be able to get the baby to latch on. There are baby mother factors that can be involved, but overall, while there is a very small chance that anything you do to the breast may impact it, it's felt to be a very minor factor in changing your ability to breastfeed, and I would definitely recommend breastfeeding after having a breast implant. Breast implant illness. Can your breast implants make you sick? The shortest answer is yes. There is a very small chance that you could get sick from your breast implants. My personal experience with this has been extremely rare. I've definitely identified 2 patients of my own in my own practice that I feel have had either a rash or reaction or illness where they didn't feel well because of their breast implant. And that's over thousands of implants that I've placed. So it's certainly something that we feel is a possibility.